reviews to cardiac rehab at IRMC.
That's so kind.
She is somebody who has been through the program recently and said it's just a wonderful program.
Oh, great.
And she
Good.
really enjoyed it, number one. And, you know, that's something that is notable because I think that people, when they come to the cardiac rehab program, most of them have had a cardiac event, and there might be a little fear when they start this up again. Correct?
Correct. They do
Yes.
have most of our patients come in with a little bit of anxiety about what we do and a little bit of anxiety about what event has happened to them.
Yeah.
And so I don't think they realize how much fun we have in cardiac rehab and what a joyful place it is to be. We have a good time there. So it's a good way to get healthy.
Well, you think about it, and they have had a cardiac event, and Sarah, it's a case where they have a barrier to get over before they can really get into the program, don't they?
Right. Absolutely.
Yeah. So what are some of the ways that cardiac rehab can help people to get over it in their mind so that they can get on with the physical part of it?
Yeah, I think they gain confidence in exercise. So we're lucky to have Sara with us, who designs a program tailored to meet patients where they're at.
Yeah.
So some of our patients who come to us have never exercised before. And some of our patients are very experienced in exercise, but are afraid to initiate exercise after a cardiac event. And we're there to support them with that.
All right, Sarah, so tell me about designing programs that are really individually based, aren't they?
Right. So we have a lot of patients that come in that part of their limitations are that maybe they just have a hard time walking, you know, whether it's from an endurance standpoint, stamina, or just the fact that they have some knee, you know, issues going on. So they're a little bit hesitant, thinking that, well, how are you going to help me with my limitations? And there is, you know, a variety of equipment that we have that we can, you know, find something that's going to work for them so that gets them on their way. And there really is a very good turnout for that as far as getting them to where they need to be.
Yeah. Kelly, that's, I think, one of the strengths of the cardiac rehab program is that, as Sarah mentioned, the variety of equipment, and each of them does different things, doesn't it, while all having the same goal.
Right, that's right. Yeah, we have a variety of equipment that we can meet each patient's needs. So if they have a preference for one piece of equipment, say the treadmill, over another piece of equipment, we're able to modify their treatment plan. Yes.
Mm-hmm. I know it's kind of an odd question, but how do you actually define cardiac rehabilitation?
So cardiac rehabilitation is a medically supervised wellness program dedicated solely to patients who are recovering from heart attacks, angioplasty, stents, heart surgery, heart valve replacement, and heart failure. So it's a wellness program. We provide exercise in the form of aerobic exercise, and then also wellness activities like talking about what a heart-healthy diet is and trying to remove tobacco from our lifestyle, and just trying to develop an overall healthier lifestyle to avoid complications after these procedures and regain health.
Yeah, yeah. There is, of course, Sarah, when we think about it, can be any type of person come in, somebody who, as you said, hasn't been exercising in their lifetime, really doesn't have that background. Also, some elderly patients might come in who once were active and now are not, and even young folks who are fit and their heart attack surprise them.
Yeah. Yes, we do have a lot of, you know, younger population that has been exercising most of their life, and whether it's a congenital problem that they've had, you know, what they're born with, or, you know, a case where they just have a family history of it, they just want to get back to what they were doing previous to the event. So that's our goal, is to give them the confidence to get back to exerting themselves and being able to carry on with their life.
Is every heart patient at IRMC bound for the cardiac rehab room?
Not everybody. There is criteria to meet to come to cardiac rehab. So you can speak to your doctor or speak to us about the specific diagnosis.
Yeah.
But like the benefits from cardiac rehab are just incredible. We've really seen people be able to turn their life around and develop a new healthy lifestyle after cardiac rehab.
I would guess as well that the benefit that you get from cardiac rehab is really going to depend upon how much you buy into it and how much you are willing to give of yourself to get better. Because some people, once they overcome that fear, then it's a lot of work that they might not want to do. But just think of how it's going to help them.
That's right. Right. It's really important to show up and commit to the program. So our program is 3 days a week. It's on Mondays, Wednesdays, and Friday. And, it's really important to show up and put that effort in 3 days a week.
And it really makes it important when they enjoy the program. And you do your best to make that happen. As that caller earlier this morning said, I actually ended up just having a ton of fun doing the program, and that leads to really lifetime habits.
Right.
They develop relationships with each other. They become friends with each other.
They get to know everybody.
They participate in healthy activities outside of cardiac rehab. So friendships are born, and we just have a great time. We have a really fun time.
We know that it's a pretty serious, event that they had come in with.
Yeah.
And a lot of them being that they are fearful, we try to make it as fun and as lighthearted as we can. No pun intended, I guess. But we just try to have fun with them. Because a lot of times, people if they haven't exercised or they just come in and look at this equipment and say, I've never done any of this before. And they're kind of already in their mind thinking like, I don't know, this just isn't for me. And then, they get in there and they're with a group of people and they kind of get used to seeing them, 3 days a week. So it's kind of becomes this little family net there.
And for somebody who's going through this for the very first time, they are going to be so darn monitored while they're there, and they're never going to be in a safer environment for getting rehab than they are when they're there in the cardiac rehab lab at IRMC, because each of them is going to be wired up. And there's going to be someone looking at that screen the whole time, knowing what heart rates are going on, knowing everything that they can biometrically or however it's measured. It's a really, really well-designed program, isn't it?
Yeah, I really want to make people feel safe when they come into cardiac rehab. So, I watch them closely for their symptoms. Like you said, they're wired up. They're wearing a heart monitor. So I'm watching their rate and their rhythm. And we talk about symptoms and symptom management. So I'm there to support them in a safe place. And we're right there inside the hospital, so it's a safe place to initiate exercise.
Yeah. And there are certain things that you're looking for during the rehab as well. I'm just going to throw this one out. Certain heart rate that you'd like them to reach during the rehab, certain ways that they can not only warm up but also cool down, which is so very, very important.
Right, yeah, we give them the education about that, about why it's important to warm up. Each time they start their program or the routine, we always have them do a 3-minute warm-up and a 3-minute cool-down, and we give them the reasons why it's important to increase the heart rate to prepare for the workout that they're going to do and put the stress on their heart, and then why it's important to cool down as well. But during that time, my job is to try to get them to their target heart rate as close as I can, while asking them their perceived effort on how they're feeling during that intensity. And that kind of helps me gauge, where to put them to help to increase how they're going to progress, really, is judging off of how their target heart rate is reached.
Sarah, tell me, how did you get into the cardiac rehab program? What was the background that brought you there?
So I worked actually for S&T Wellness Center for the past 11 years, which is the hospital wellness center. So I've worked there 11 years, and I was in contact with the Molly Balka, who was, the previous exercise physiologist. And we kept in contact with each other. So when she had a graduate of cardiac rehab coming, she would send them our way. We try to promote that wellness center because it's a good transition for the cardiac rehab graduates. So I got to work with a lot of the graduates that had come in, and they can continue their exercise regimen while being, kind of like a nice little step down. So they're not just kind of thrown out, on their own, but they have a nice, safe place to go to after.
So that was a natural transition for you.
Yeah, so it was a very easy transition.
Yeah. And Kelly, you were actually working in the cath lab at one time. Are you still?
Right. I started in the cath lab over 15 years ago at IRMC. We have the best cath lab. Like, they're just incredible professionals who save lives, and I get to play a small part there. Still, I get to spend a little bit of time there, but my main role now is cardiac rehab.
Yeah. When you got into nursing and imagined where your career might lead you, was it going to lead you all along into the cardiac rehab program?
Yeah. So, I loved nursing. Every facet of nursing I loved. So I've kind of wanted to explore it all. But I'm really happy where I am right now.
Yeah.
It's a really great place to be.
Yeah, and that experience of working in the cath lab really, really gives you some great insights to work in the rehab.
It's an incredible place to work. Yes.
Yeah. So I'm guessing both of you would highly recommend cardiac rehab at IRMC.
Absolutely. Come visit us. Yes.
Yeah.
We would love to have you.
Yeah. Now, do you have to have had a cardiac event in order to be there?
You do. You would have to have a qualifying event over the last year. And
so you would come from a referral from
your
provider.
Our patients from the cardiac cath lab are referred to us, but so you would have had to have a heart attack, an angioplasty, stent, or some type of heart surgery or heart valve replacement. Also, we support patients who have heart failure. But we don't just serve patients from Indiana Regional Medical Center. Actually, a lot of our patients come from other hospitals.
Oh, yeah.
We see a lot of patients coming in who have had their heart surgeries in Pittsburgh or at Butler or in Westmoreland County. They come to cardiac rehab right here in Indiana County at IRMC with us after their surgeries.
That sort of speaks highly for the program, too, doesn't it?
Yeah.
Well, ladies, it is a wonderful program, and we're glad that you're able to explain it for our listeners here this morning. Health Month, Cardiac Heart Health Month is such an important aspect of your overall health picture, and you're putting people back on the road. We appreciate it.
Thank you.
All right. Thank you.
Thank you very much.
It is the voice of Indiana County. It's WCCS 101.1 FM and AM 1160.